Okay, Jacob, Jacob. What's your? How do you pronounce your name?
In Danish, you'd say Jakob.
Jacob.
But as I've gone abroad, Jacob is more familiar.
Yeah.
I think to most people, especially in Korea. Usually I just say, Jacob. Like if you watch Twilight or something, usually
Yeah,
you know the name.
To be honest, I was a fan of Twilight. When the movie were released, I was in the United States, and then I was in the middle of nowhere, basically New Hampshire and Hanover. I mean, there is a university, but basically there are. I mean, the population is really small.
Oh yeah.
So I go to the movie theater alone almost every weekend. Every movie I saw every movie. So, okay. So please tell me a little bit about yourself. And yeah.
Yeah. So my name is Jacob. I was. I always answer like this. I was born in Korea, down in Iksan, but actually I grew up in Denmark. We moved there when I was 3 months old. So for me, I'm Danish. I spent 18 years there, moved to London, moved to Paris for a brief before actually coming back to Seoul about now 3 years ago. I finished my bachelor's here and really liked it, decided to stay. And now we're sitting here.
Great. Okay, so do you feel South Korea home or Denmark home? So I was born in Daegu city. Daegu, you are very familiar with it, but still I feel like I'm a Daegu 사람.
You feel more familiar.
I spent 4 years there. 4 years there in Daegu when I was born.
I mean, Korea feels more and more familiar to me, as I'm growing accustomed to life here. But like my first 6 months here I thought it was a huge mistake moving to Korea. I was like, there's not enough English. My Korean is terrible. Even my first kind of, interaction in Korea was going from Incheon airport to my hotel. And the cab driver asked me, in Korean, like, oh, you have a Korean face, but you don't speak Korean. This was I swear to God, this was my first interaction.
I mean, maybe we talk about it with Cave. Cave.
Yeah, a little bit.
So whether it's difficult or not, I mean, if you don't speak in Korean, I mean, how difficult you travel or you live in Korea? And he said, it was totally okay. But I think it must be more difficult for you.
I mean, we have kind of different angles, right? Like I've lived here for 3 years. I went to university here, like a Korean university. And, Korea or Seoul at least is very foreigner friendly compared to when I first visited Korea in 2016 maybe. But still, especially at university, you can feel it's maybe not that geared towards English yet, even though my major was English spoken. Like, all of the clubs, 동아리 and all of this, it's all Korean. So I had to learn really quickly, and it's still terrible. We always say, I think I speak about a similar level of Korean to about a 5-year-old.
Well, I still speak to you in Korean.
The understanding is better, but my spoken, I think you would. I spent 6 months teaching here at a hagwon, like at an academy, and the youngest students I taught, they were like 4 or 5 years old. I think we spoke about similar Korean. It felt very similar when we were speaking together.
So Gabe is like he still speak a few words in Korean, and anyway, so what do you do at Himedi, and when did you join Himedi, and what did you learn? How did you find it?
Wow. I've been with Himedi now since about start of January this year, so coming on 4 or 5 months. What do I do? I it's hard when you're sitting across from your CEO. Sometimes I struggle to define my exact area because I think I touch so much. So the way I like to define it is Himedi is this bridge between like into kind of Korean healthcare or like a healthcare journey. And I'm kind of helping build this bridge. So whether it's making sure we can work better with our partner clinics to find the right care for our patients, whether it's just addressing patients' concerns better through our concierge work, I kind of touch all parts of this, mostly from a back-end perspective. So usually people don't see me that often, but yeah, a lot of what's going on behind the scenes to helping our patients get better care is kind of what I've been doing here. I think that's how I like to define my role.
Okay. So this is not the main topic. So how do you think AI
AI
and all the new technologies
for healthcare.
are change our industry?
Oh, it's difficult. I can give a good example. So I got my health checkup report in. Actually, they sent it to me in Korean first, and I was like, "These are just numbers. They tell me they look normal. Some of them were at risk," and I was like, "I don't know. Here, like, Claude, help me understand this." And I think it's where we're moving. So an area where I'm really like personal interest is like wearables, like Aura rings, Whoop bands, smart watches, and all of the tracking that we do has become much more available now that we don't need someone to analyze it for us that much. I think that's the biggest shift we will see soon. It's about how we can make sense of trends and data in this and insights into it. So one data point doesn't make sense, but as soon as we can track it with our wearables, with our health checkups, we need someone to analyze it. And it's very expensive to get a doctor to do it every time. So if I need a just direct insight, well, I might go to my, apps to look into it.
So, the reason why I invite you to the podcast is, first of all, you have lived in different countries, Denmark and briefly France and the UK. And the second thing is, this is why we asked you to join Himedi, because you can see the business, the service, and the industry from fresh eye. I started this business before pandemic, and so among all the industries, all the market, what is, from your perspective, what industry is the most outdated, most fragmented, was not automated from your in Denmark or in Seoul?
The least automated part of this is always like in Denmark when I go to my GP, I call to make an appointment. Whereas, like we were speaking about France earlier before we started recording, and Dr. Lieb as an app has made it very, very easy to find a GP, find a second opinion, and address your specific needs. Where I think in Denmark it's the opposite. So you have a primary and a secondary system, right? Where your GP, general practitioner, is your access point to all specialists. That means you need a referral to go to any specialist. And that can feel quite frustrating for many people, because either waiting is long and they always try to triage you as to how urgent is this need. Of course, we have ERs and everything, but if it's not super urgent, if you're young or it's not at risk, usually you get deprioritized in the Danish healthcare system because we have a free healthcare like across the board, so it means who gets priority, and that's usually the patients at risk. But in Korea, it's partly financed, right? But through the healthcare insurance, you pay a little bit yourself, but there's so much more availability to specialists because you can go directly.
But I guess I guess you think our industry and our service model is changing so fast using all the technology, and before pandemic, uh, it was really outdated industry.
How so?
You know, for example, for example, language. There was no translator. I mean, people literally translate manually, one word by. And then do you remember Google Translator?
Yeah.
It sucks. Yeah. And then we are doing medical services.
Yeah.
So, what I mean, what I want to say is, first, medical industry in any country generally they are behind compared to all other industries in terms of automation and technology. But what I've seen is what I've seen these days in our industry is we are working in the cross border, and then this is kind of out of the national health insurance like area.
Yeah.
So that's why we are changing so fast. And then that's why you joined Himedi, using AI technology and the right SaaS service and automation. And so I think this is great time for customers to get the benefits from the advancement of technology. And then this is yeah at Himedi. Yeah.
No, absolutely.
Yeah. Okay. So in that context, I mean, in terms of technology, you have been to the most advanced checkup center in Korea. You just have been to the Bumin,
Yeah.
which is the most advanced in Seoul, I believe. And then I want you to compare that experience to your experience in other countries, especially Denmark.
Wow. Let me start. So I just came off, like, last weekend was my checkup at Bumin. I got my results the day after. It's hard to compare to Denmark because we don't have health checkups. So already there, I think it's your biggest point of comparison. If I were to compare like the systems that we kind of build in Denmark, in parts of Europe actually, we don't do preventive care as much as we do. We treat when there's an issue. And usually when you're in your early 20s, like I am, you don't really have issues, so you don't see a doctor. But in Korea, even when you're young, you get, your free health check every 2 years at least, and then you can, get more checked if you need it. And this starts from a very young age here, I think, right? You'd probably send your son to a checkup, right?
Not now, because the government recommend you to get the checkup from about late 30.
Late 30s?
Yeah. So full health checkup, yes.
Yeah.
Late
Full health
30s.
checkup. But these kind of baseline checks that we're getting now.
Yes. We have like checkup for child.
Yeah, exactly.
And the government recommends it.
Yeah.
And backed financially too.
Exactly.
Yeah.
So it's super affordable. It's recommended. But in Denmark, if there's no issue, there's no need to see a doctor.
Yeah.
I never had a blood test done in Denmark before I came here.
So, I mean, I think there are so many things we should talk about. I mean, let's assume that, so Americans already, not everyone, but part of Americans are already familiar with annual checkup, the concept of annual checkup. But let's talk about from European standpoint.
No. So I wasn't aware.
From the very basic thing.
But I wasn't aware. That's what I mean. Like I never had any kind of test, like preventive baseline test done in Denmark. I didn't get a BMI. I don't get my fat percentages measured unless I go I specifically want to pay myself to go to a private clinic. It's not part of like what we do.
Okay, then so so uh, let's assume you are having coffee with your friend in Denmark, and then he knows nothing about Korean health checkup. And then how do you explain what it is to your friend in a plain language?
Oh, in a plain language, the
Yeah.
Korean health
In
checkup.
in 3 sentences.
Oh, I think, wow, that's difficult. The Korean health checkup, it's a great way to get your baseline stats, especially when you're young, and focus in on things you may not notice yourself. So what's important for me and to get measured, like, things I care about is like preventive diseases like obesity, diabetes, cardiovascular. You know, 1, 2, 3. Those are important to me, and those are exactly, I think, what's measured in our baseline test. Also at Himedi, you know, your blood works, your basic tests, and I think that for me is important to know even in your early 20s, because then we can start seeing the trends into your 30s, and that's what makes it really, really interesting. And we don't look at that ever, like in Denmark,
Okay.
unless you have an issue.
I think a few more things very helpful for your friend is, so you don't need doctor's order or prescription to get an exam. Have you imagined it before? So can you get a like MRI scan without doctor's prescription?
No.
You
You
can-
need
you
you
cannot
need you
imagine,
need
yeah.
something wrong. Like this kind of preventive screenings are really unique, and I mean it's where the systems differ. Korea is amazing for this. Like you have a clinic for everything, and I was surprised how great they are, how high tech or how specialized some of them are. Like you know, we see our GP and they treat us, help
Yeah.
us with everything, but
Yeah.
here you go to specific clinics for everything. And I've been to so many clinics here, and I've seen them both with our work, but also like privately, and they're really great at what they do because they are allowed to be so specialized and so fast. And I don't need to see my GP before going to a specialist, which means I get the exact care I need when I need it. And I think that's really, really amazing here.
But I mean that implies the downside or can lead to the misunderstanding from European perspective, because it sounds like the Korean checkup center is operated by non-healthcare like professionals, right?
Here?
I mean, let's say we are talking about it with your friend, and we just said you don't need doctor's order to get MRI in Korea. That sounds like this facility is not a medical institution, but more likely uh, just imaging center,
Ah.
just solely for the scanning.
I mean,
Yeah.
we have great partners, and we
Yeah.
pick them based on it. We can talk about MediOne, for instance, that are so specialized in the MRIs because they are, you know, they work with them before. It's not a random image clinic. You know, they'll adjust it there to what you're concerned about, and you get a consultation. In that sense, it's not like a random drop in for
Yeah.
for a scan. It's really like they're really, really great, like at addressing your concerns as well.
Yeah. So, I mean, to help your friend understand it better. So, if I share the Korea's regulation or system, prevention healthcare system is, you know, Korean government believes the Koreans have the right to choose. So healthy individual in Korea have the right to choose their checkup package. So that's the first one. So the Korean patient or the international patient in South Korea, they cannot choose an MRI solely, alone. So they have to choose the package. And then the package should be pre-designed by the doctor. So that's how it works. Yeah. And then why the European countries don't have it? And then what is the pros and cons, basically? We should be neutral and help the customers choose make a right decision. So,
why we don't have it?
Yeah.
Oh, I think you have to ask a politician that. It's
Okay.
think
this is podcast. This is where you should talk about political things.
Oh, it's a difficult topic.
Okay.
I can rephrase it.
So, the health checkup system is not only Korea has, but Japan, Taiwan, China, any Asian country who have a healthy healthcare system, they have it. But Korea is famous for 빨리빨리. So operational efficiency.
Yeah.
But this is the core of the Korean health checkup system. Because Koreans are so efficient in a one building, there are so many expensive equipment. But when you can run the system efficiently, you can make money because the utilization gets higher. So South Korea make it like steady, long-lasting, healthy business. Yeah, that's something different from other Asian countries, but it's universal in Asia. Yes, it's Europe and Asia.
Like from the Danish perspective, let me say it this way. I think we care a lot more about your relationship to your GP. So someone who's probably seen you from you were a child, unless you change to then when you go into, late life care, they can be the same doctor all the way, or at least the same, practice. We value that relationship a lot, but it also means that it's a mindset, basically, that preventive care is on you. It's not on like government to sponsor it necessarily. It's not on the government to do anything. So we don't believe in this kind of like comprehensive health screenings unnecessary. I think personally, okay, let's go a little bit political then. I think we treat it terrible in Denmark. We drink a lot, we smoke a lot in Denmark, and it means we live shorter than our neighboring countries, and we don't eat enough vegetables, etc. And it's on you to then solve that problem, not on the government to help you necessarily. And I think that belief system is wrong, and we need to start thinking about preventive care a lot more, especially as lifestyle diseases, they keep growing. And that's why, I love this Korean checkup, because I can check my cardiovascular risk. I can check my obesity and, specific things I need to change, such as good and bad cholesterol that they check for me. And I'm 23, 24. I can't get this in Denmark. I need something wrong for me to get it. And I think it's just the difference in belief systems, but I'm much more into this Korean belief system of preventive medicine. I think it's important.
Right. So if your parents are coming to South Korea, do you recommend to have checkups?
Absolutely. I mean, my parents, they're going into their 60s now.
That's
it's super important. No,
super
you're
important.
right. Yeah, it's super
That's
right
the right
there.
timing, right?
Right there, and it's maybe also at the age where you're not looking at our baseline checkup anymore, but you're looking towards some of the more comprehensive test panels we have. For me, like if I compare to my situation, I'm not that interested in cancer mark. benchmarking, because I'm 20, like, what is my risk level realistically? But, my dad turns 60 this weekend, and I think it's much more relevant. So then we may look into larger tests. I'll talk to them about it too, because, the preventive things we do in Denmark, they're mostly geared towards cancer, but not cardiovascular in the same way or obesity. And it's something I think my parents would, I think it would be good for them at least to get a check.
One thing very sounds interesting was the Danish people think of the relationship with GP very important. From local, like me, local Koreans' perspective, European people, 뭐라 그러지? Think more reasonably. I mean, the Western thinking way, Western. South Koreans, Asians and Koreans think the relationship much more important. That's our like prejudice. But it's very interesting. I mean, because of the relationship with GP, hard to change. To see new GP or new system. Anyway, so okay. So we started with technology. And that's why we are here at Himedi. And so, now let's compare Boomin's checkup system to other health checkup system in South Korea.
Oh yeah, I went to KMI my first year here. KMI, let's start from KMI. KMI, I went maybe 3 years ago. It was my first checkup in Korea, and I was just blown away by how large this center is. KMI, they have some of the largest ones in Korea, and they're super efficient at going through the tests, but you don't you just go station to station, get all your tests done, and then you're sent out of the door again. Where I felt, last weekend I went to Boomin, and one thing is just the facility out there is amazing. It was beautiful. It was like, even if you read the Korean reviews of Boomin, they all say like this is better than a hotel. Like it's interiors, and I know we have some images of it on our website, and I really recommend people to go take a look, because when you see it, you don't believe it's a health clinic. But you went there. You went there with the US team, right?
Yeah.
It was quite surprising how well designed it was, how quiet it was, and how friendly the staff was. Not that KMI are great, but they're not at that same level, because their facilities are older. But Pumin, if you want state of the art, you go there. I think that's how I felt the difference.
How was English? Their English, Pumin's.
Pumin, they actually, I'll give them this, props to them for their service care. They saw I had, my name comes in foreign, so they called me and they said, "Oh, do you want an interpreter with you?" They actually took that extra step. And this is how we check our clinics too, right? At Himedi, we care about things like this. They called me, they said, "Oh, do you need an English interpreter? And do you need to add any other tests, such as, I don't know, all our add-on tests that we may have?" And I said, "No, it's all right." Like, I was coming with a friend, but, the fact that they called me and asked for it was already, like, great. And they offered, a consultation after with a doctor, with an interpreter as well. Where at KMI, is super efficient, super fast. Not a lot of English help if you don't get an interpreter.
Well, how about the the signage on the wall?
Yeah.
And screen?
I never thought about it. So, like, most of them, like, in Korean and then in English. I didn't get lost. Let me put it that way. Pumin was really great at everything that they did.
So, and I visit so many different checkup centers, and if you look at their signage, so some checkup center, when the owner from when the owner designed it, I mean, they thought about English-speaking customers. But the other centers, they never thought about English-speaking customers. Then suddenly, they started receiving English-speaking patients. So the first one, I mean, the sign is I mean, you can read the English much easier.
Yeah.
The latter one, I mean, even if there is an English translation, it's very hard to read it. So I want to talk about KMI because they also our partner. But Boomin, I think their English is their signage is easier to read. And then one more thing is, some hospitals and some partners, if they suddenly think about receiving more like international patients, they just put Chinese, Japanese, like Taiwanese, all the languages everywhere. And then now customers, very hard to read it, understand it. But Boomin is more simply English and Korean. Yeah. So that was impressive to me. Yeah. And you were backed by NHIS, I mean National Health Insurance, but still they ask you whether you need an English interpreter. That's another good signal.
I think it's a great sign. It's the fact they called me. Like just, hey, we saw you book this. Do you need this? It's it's the kind of customer service we dream about.
Coming from Himedi.
No, I don't think so. I hope they didn't know.
No. That's what we intended. I mean, to send you, right?
Yeah. So it was a really great experience. And Boomin, I mean, I think the reason I didn't think about the signs was because they were so like attentive when you were walking through. Because these checkup centers are huge, and you can get lost very quickly.
They will expand even more.
Yeah, right. So but they were really good at guiding me through so I never honestly I didn't need to look at a sign.
That's even better.
So I think that's why I was the signs I just needed to think back, because I was like, what language were they in? Because the staff members guided me all the way. At like different corners, or like, you need here for your blood works, here for your your hearing test, and do this.
Well, the best service is, I mean, you can feel it's the best service. Basically, it's so natural. I mean, you feel very comfortable. Yeah, it was a nice experience.
It was a really great experience, and I think even when you impress the Koreans that go there too. If you read the neighbor reviews, I think it's a sign of like something really like, unique for a health checkup that is so average. I think,
So when you get there, and then I'm sure you went to the reception desk, right? How do you register? So you talked to the receptionist at the desk, or did you use the tablet?
They have on the wall they have 2 tablets to check in and check out. Then you go to the reception just to say, hey, what.
And it was in English, the tablet.
Yeah, the tablet has an English option, and
so there are so many hospitals who provide tablet, and the customer should use Korean phone number. That's a big hurdle.
Yeah.
And then secondly, it's not, I mean, provided in English.
Yeah.
So I mean, Boomin, okay.
No, they did it's a sign of something, high, and we knew it. We knew it when we went there, right? As
of course.
Himedi.
I mean, that's why we partner.
Yeah, no, we care a lot about our partners.
Yeah, and then I know, the most, because I was so impressed when I get there. The first one is the chief director's ownership, but let's talk about it later. But the second thing is, I mean, it's not about how visually nice it is. It was more likely their technology. So, have you seen any any point that technologically advanced or automated, anything. I mean, it's very hard to see because from the customer's perspective, if you go deep inside, that's where the technology works there.
I would say this: Pumin has a window into that testing lab.
Right.
At the checkup floor. When you go past it, you can see in where they're doing the urine and the blood tests. I'm not medical. I can't judge how advanced that is, but I can judge this. The fact that they told me, "Oh, if you need, we have your results ready in a couple hours if you want to talk about it with a doctor." The fact that they can go through all my tests I did, and get me to sit down with a doctor again within, let's say, 2 to 3 hours. It speaks to, I think, a high level of at least analysis tools that they have available.
So think about how that is possible. Why do you think it's possible? And why it's, I mean, 99% checkup center is not possible.
Yeah, right.
You can see the doctor after checkup, but without the result.
Yeah, without the result, or you have to come back later for when you have your results. But, as I said, Pumin gave me my report the day after, and they said, actually, on the day, we can have the results ready for you. I think Pumin is partly their size. We know that they are huge, and they hired a lot of staff, and they're still expanding. And then I think it's so new that technology is just state of the art that they can do things like this.
Yeah.
And they care. I think it goes back to, how we look at clinics, right? How do they care for their patients? I think that's the first question we ask ourselves, right? When when you evaluate a new partner, right? You always told us can they care for our international patient needs? That's the first question we ask ourselves. And I think this is part of it because most of our patients are tourists, right? And they leave the country, let's say, within 7 days. But the fact that then you can get something so fast, it's a specific need for tourists. Because we live in Korea. We can wait 5 days for a checkup result, and it wouldn't really affect our day.
So, one big part. So, for example, one big part of the exams is imaging scans, right? And the chief director explained me all the imaging scans they use AI detecting technology, and I've seen it. But that doesn't mean radiologist doesn't involve in it. But basically, radiologists, what they do is just confirm it. So, and they, their AI technology is very sensitive. So they are trying to over-diagnose it, and because it's better to detect every single and abnormalities, and then the radiologist cut away.
Yeah,
and then that means their electronic data just 큰 유리로 된 diagnostic labs, in-house diagnostic lab. Basically, that room, there is where every electronic data come in,
right,
and then process it, and then they issue the result report in a few hours, and then basically they are trying to minimize or just get rid of the human errors. That's because, all the data move back and forth electronically. And then, for example, another good example is blood test sample. And then I don't think you have seen it, but actually there is a conveyor belt. So people doesn't carry it. But if you go to, I believe, but in Denmark, so, on the table, I think you have seen the blood test samples.
Yeah, the small tubes.
뭐라 그러지? On the table, it's waiting to be moved.
Yeah, like the trays with the
samples.
Test in it.
Yeah.
I've seen that in Korea too. I'll see.
Yeah, because Bumi is the most advanced. So most of Korean hospital also do in the same way. Yeah. So so that's why they can develop and finalize their result report in a few days, and just it's a big value. Yeah.
But of course, I think this is turning into a Pumin ad. We are advertising one partner so much here. We love all our partners, of course.
Right. Right. But that's true. That's true. I mean, we should speak, the truth. But there is, of course, there is a pros and cons, right? It's located in Magog, right?
Yeah.
So how long does it take?
I think
Magog is part of Seoul, basically.
yeah, part of Seoul, but outskirts, right? I think from my house, I live up north near Dongdaemun. I think I spent a little bit more than an hour getting there, which is like by metro and like that right on the station, but it is out of the way for sure.
Yeah.
Which
Have you walked around in Magog?
No,
No.
I don't come that far away that often.
Because I also thought it's far away from Gangnam because I spend most of the time in Gangnam. But like Moomin, the new and disruptive players like Boomin and, for example, Cha Magok, the fertility checkup provider. So many new and advanced hospitals are there, and then LG's R&D center is there.
Yeah.
So and there are so many like tourist attraction there. So I was surprised, and then I'm still advertising it, but it's true. But it's true. So people love to see hidden place. Like you can see the trend change so fast, even for the international tourists in South Korea, and then maybe Magog is will be very popular in a few years. That's what I'm thinking. Yeah.
So
Yeah.
the official Himedi recommendation is skip Myeongdong, go to Magog.
If you want to try new one, because there are if I list a few attractions, the first one is Seoul Botanic Garden, and then there are Cafe Street, and there are famous galleries too. Yeah, so it's worth checking. Yeah.
There you go.
Okay. So let's move on to the dentistry.
Oh, right.
Right.
So
just tell me about
yeah.
your experience. Yeah.
We went. Another partner with us. We went to Sero, right off like Serateeth, right off Gangnam Station. So a little bit in more familiar territory than Magog. This dentistry reminds me, like the way it works is similar to Denmark because we have private dentists in Denmark too, right? So you come in with your, checkup needs or your issues. What I would say about Sero compared to other clinics I've been to in Korea is they had an English-speaking dentist, and she was great. Like all props to her because I went back and forth with her a little bit about what I was experiencing and what she was seeing, through the X-ray and the first examination, and she was great. She addressed my concerns. We discussed some of the treatments. I got to, some of them we could push off for a year or so. Like I get my regular dentist checkups every year, but I would say this is the first time where I've been able to go back and forth with a dentist that easily, especially in Korea. Not, you can find dentists here that, speak English and whatever, but she was so, like, again, it comes back to my experience, right? She was so attentive, understood my concerns that I was also, I'm relatively young, so she was like, we can leave it for 6 months and we can take a look again. Let's not react now, because that's how I felt as well. Like, this is not an issue now. It could be in the future, so I wouldn't want to go overboard. And she met me where I was complete, and she was like, let's take a look in 6 months or 1 year. see how it developed. And there's this, I need a polite way to say it. There's this prejudice towards some dentists, also in Korea, that they will try and push a lot of treatments on you because maybe they only see you this once a year, once every few years. So they need to recommend you so many treatments. But the fact that I have a dentist here that can meet me halfway and say, I completely understand you. Why don't we take a look next year, in 6 months, at another checkup to see how it develops and then make a decision? I think that is, that's something I noticed a lot. And then, of course, they were great. They had high-end, x-rays, a skin scan, which I was surprised about, or at least a composition, and just the general cleaning. And, I think that was really great. And,
Do you know why we approached Zero and then partner with it?
No, actually.
So basically, after pandemic in 2023, the first boom was coming from dermatology clinics, and then plastic surgery was always very popular, and then the vision correction, and then dentistry, and those dental clinics who were leading the growth of the dentistry for international patients was aesthetic dental clinics, and then they are so much focused on whitening and veneer laminate. So we saw the structural issue. I mean, if you specialize in one treatment, you want to push the treatment.
Of course.
And the reason why we like Zero is they are like the experts in implanting. Yeah. So especially the chief director is, so basically among all the medical schools, especially the dentistry schools, Yonsei is very famous. Seoul and Yonsei.
You have to say that you're biased.
I'm objectively saying.
He went to Yonsei.
Oh, it's true. Newsweek rank, you see the rank. Anyway, the rank. And so, the chief director has a long experience in implanting, and he is basically doctor's teacher. So, and the first visit a bit disappointing, right? There are so many people crowd, the Americans and Europeans who, especially the Western people, it's important to be private a little bit. But when
crowds.
the new floor opened, it was perfect place.
Oh yeah, the second time we went there, the second floor they opened, it was so much nicer. I remember you spoke about it with the American team we had in, right? It's I'm Scandinavian. We don't stand that close to each other in the metro and stuff, and especially at a clinic, I wouldn't want to be this close to people. It's a Scandinavian thing, maybe, but
so Rebecca,
so crowded.
I still remember Rebecca's famous. I have a quote from Rebecca. She said, even during rush hours, Americans keep the distance.
Oh yeah, maybe. Yeah, I don't know. Yeah,
I don't know if that's
probably.
what she said.
Yeah, probably.
Even in New York. So I was surprised how come they. So that distance is really, really important. But I also can be a bit biased. But in Asia and Japan or Korea, you grew up together basically. Grew up together, and army as well, and 수학 여행. 뭐라 그러지? High school students go to
the field trips.
Field trip and just sleep together in one room, like 20 students like that. That's what happened in Korea before. Yeah.
I went to a boarding school in Denmark, and we have sleeping quarters. So everyone sleeps in the same room, basically. But there's still a good, at least half meter between the beds.
Half meter is It's a palace.
I can't I'm not that Korean yet. I need to spend maybe one more year here and I can be comfortable in this kind of space. But yeah, it was a really good experience at Zero. I think I'm happy they opened the new floor, and I think it's good. Like it's a good fit for our international patients now.
Well, let's talk about two more things about Zero and the dental clinics. So the first one is, have you heard of one day implant program?
I mean, I see it because I work with them, but in it's not a familiar concept for me personally.
So have you done the implant?
No,
No.
no. I have healthy teeth.
Okay. Can you help me translate what I'm saying in English?
Oh, this is a live Korean test that is being recorded. Oh my.
Okay.
Don't you?
So so basically, I talk about I wrote the blog about it. So I don't want our international American customer to be confused about the one day implant concept because it can waste of their time and money.
Yeah.
So basically, the truth is they should return to South Korea in 2 months.
Yeah, to get it checked.
Yeah. No,
And
to
then
put the
after-
crown on it.
Oh yeah.
Yeah. So the permanent one. So, what? So in the past, I'm trying my best to explain in English. In the
Thank you.
past, you have to 그 이를 뽑는 거 extract.
Yeah.
Do you call it extract or 이를 뽑는 거?
Yeah, and you have to make so basically they drill down, right?
Yeah.
And then they put a cover over until they can put the permanent in.
아니 when you put the teeth away, basically 이를 빼고 you cannot drill and implant the implant on the same day.
Yeah, exactly. That's
on
what
the
I mean.
same
Yeah,
day.
and
But these days, the specialists they can do it in one day. So 이를 뽑고 drill down and implant on the same day. That's the one day program.
yeah.
But the crown is not a permanent one.
No.
Yeah, because they need to time to make it tight and then 그 자리를 잡는 거. I mean, yeah, 자리를 잡는 거.
In English, that is.
Okay.
Now my Korean is getting exposed on live camera. Wow.
My English also.
I should have studied topic harder.
But it takes time
to make
get
the right
tight.
thing. Yeah, and
right place.
yeah, like the right fit and
right
the mold.
structure.
And,
Yeah.
I mean, it takes time.
Yeah, it takes time, and then it takes about 2 months. Then so to change with a permanent crown, they should return to South Korea. So I really wanted to explain it through blog and social platform and podcast because even local Koreans are tempted to the one day program.
Yeah, because it sounds so
Yeah.
the appeal is right
But
there.
South Koreans are okay. I mean, return to the dental clinic 2 months later. I mean,
It's fine. Yeah,
still,
again, we can wait.
Still, they can save a lot of time and money, right? But for international patients, they should make informed decision.
Yeah.
Whether they can come back to South Korea again. Yeah. So that's
to get the
something-
final fitting.
Yeah. And but still, we started with whitening and cleaning our business because that's the basic things. But the reason why still it's worth checking implanting is it's how much it costs in Denmark.
It's so expensive.
Yeah.
It's so dental work is not covered by government. It's fully private basically. You can have a private insurance, but let's assume no.
Assume no.
Assume no. Like I think depending on where and how much I think you're looking at a good, like a couple $1,000s towards this kind of treatment. Again, it depends always of how bad it is
Also, it
and where it
depends. Yeah, of
is.
course, it depends on which city.
Yeah.
Also, I mean, which manufacturer, for example, Straumann in German,
It matters.
it's a bit expensive.
So,
Yeah.
again, fortunately, I've not had to do it, but I know, my dad, he spends a lot of, like, he has bad teeth, and we spend maybe $1,000, $2,000 to get these kind of things fixed, and it's it's expensive, it's hard, so people may postpone it.
Without insurance,
That's before insurance.
before insurance, 2,000.
Maybe somewhere between 1,000 to
Yeah,
2,000, somewhere in between. I think
it's if you choose the most expensive implant brand, it costs I think 1,000 in Korea.
Yeah.
And there are many level of grade of implant, but most of implants brands are great.
Yeah,
But
nowadays,
it depends on how long the brand lasts, something like that. And then if you choose the expensive one, it costs 1,000. And then, do you know how it costs in the UK or in America?
No. I never went to a dentist there.
It's 뭐라고 천장을 뚫는 거 뭐라고 하지? It costs about 4,000.
Yeah.
5,000.
I heard like
in New York, Williams said it costs 5,000. Yeah.
Yeah, I heard it goes towards like kind of
Yeah.
price range. Fortunately, then in Denmark, all of a sudden $1,000 sounds affordable. It's a crazy sentence.
So, if you have 2 implants in South Korea, you save. Let's say the customer is American. You save at least $6,000 if you do 2 tests in South Korea. So, the reason why it's so affordable, that doesn't mean it's not. I mean, the quality is not good. It doesn't mean the quality is not good. So the penetration rate of the implant in South Korea is the highest in the world. Vision correction, same. A lot of things. I don't know. Everything goes so fast here. AI.
But I mean, I was curious. I asked you before, because I looked at Sero's price list and I was like, this is cheap.
Yeah.
Like, not in a bad way, but compared to what I'm used to paying and seeing, how can you lower the price this much for dentist work that is so expensive anywhere else?
So, there are medical categories have high dependency on the device manufacturer. And then South Korea is, basically, the implant manufacturer, this is the market, where the battleground, which means competition, and it reduces the price, right? And the fact that the penetration rate of implanting is the highest in globally means, the dentist can do it very cost efficiently. So basically, we talked about the crown, and then you have to do the milling machine, right? And then the expert who can who can produce the crown on the same day, and then Sero and Minish our partner, and those Himedi's partner who are very capable in Gangnam area. They have their own milling machine and in-house lab too. So basically, fast means they can care many patients, so that reduce the cost. Yeah, and then South Korea. So basically, when you talk about the medical equipment, in many cases we talk about Germany, not US. Sorry. Because German engineering is famous, and vision correction is same. So South Korea's the eye vision correction center, they use German medical devices, and dermatology clinic also used Botox from Germany before, but South Korea catch up so fast. So basically, for example, Ostem Implant is a Korean implant manufacturer, is like in top, and by revenue, I think it ranked top 5,
Yeah.
top 3 to 5. There are Korean implant manufacturer like in top 10, like maybe 2 or 3. And then South Korea is very close to Asian market, especially China. So it's easier to export and develop the markets. So the market share grows fast. If you got scale, I mean, they can produce their equipment at the low cost. That's how it works behind the scene.
This
Maybe
is out
too
of
much
my
information.
world. This is out of my world.
Well, so you joined Himedi like this January, but when you choose the partner, we are trying to understand what's happening behind.
Yeah.
So basically, before like English sign easy or the tablet in English, that's the last thing we check. The first thing we check is about more structural issues. And then, for example, why there are some dentists, Korean dentists, push you to get many treatments. We are trying to understand the structural issues, and then from that base, we shortlist the partners, and then we think about their customer experience, right? Yeah.
Yeah, well, I see the last part of this, right? Hey, Jacob, we have a new clinic integrated.
Yeah. So let's go to more easier part. I said, let's talk about 2 things. The last one is about the dental clinic experience is English. So, so can you just still your fresh eye? Can you talk about a little bit more about the dentists?
But she studied in the States. I can't remember the university now.
Yeah.
I think it was USC. Maybe.
I think so. That's why she speaks in English very well.
Yeah,
right?
of course. Yeah, no, of course. That part of it, and so it was a quite it was a really good experience because it was so casual.
Because they know that generation, they know how they can communicate with you are not international patient. I cannot say you are living in South Korea, but international patients,
Yeah.
right? Yeah. So the second question, following question is, have you seen other young in 30s or early 40s in 30s? I also studied in the States for 2 years, and I'm older than her, I'm sure. I'm in the middle of 40s, but still, many of my friends study in the States.
Yeah.
Yeah. So have you seen other young doctors in South Korea?
No.
No?
Usually
Do you go to the clinics in South Korea?
I think the clinics are young. I would say this: the clinics are young, but as soon as you go to a hospital, age shoots up. So I've been to clinics and hospitals. I think clinics generally have a lot younger staffs, unless you need to see a very, very specialized one. Like I got a knee MRI maybe a year ago, and I mean that doctor, he was definitely he was definitely above what I would call average for clinics.
Yeah.
But if I go to an ENT here, I mean they could be my age, some of them.
Of course. Oh, your age? You're too young.
They look so young. Everyone.
Right,
Maybe
right.
it's all the Korean skincare here. I don't know, but they look really young. Especially ENTs. I live quite close to Seoul National University's hospital, and so we also get student doctors around.
Yeah. So,
But
the general hospitals 한국말로 도제식인데 apprenticeship. So learning from your 선배, senior doctors is very, very important because they are dealing with those very serious conditions. So but clinics. The startup. I can see even among the hospital and clinics, I can see the startup vibe. Those young doctors, they want to create their own service.
Definitely.
They want to open their own clinics these days. And then what's promising to Himedi and to those international patients coming to South Korea? So if you see those owner doctors and those clinics, they just speak in English.
I would say that too. From the interactions I have through Himedi, is usually they just meet me in English.
Yeah.
A lot of these clinics.
Yeah, and so I remember when I first went to the U.S. It was Chicago. I should go to the Chicago University to have an interview, and I was it was my first time to get there. I was so concerned I should talk to Americans in English because their English is not something I learned in the South Korea from the textbook.
Yeah.
Yeah, so it's more than just language, right? Actually, it's more than just language. The experience, the exposure to international environment is very important to provide service to the international patients.
Definitely.
So it's promising, I think. Yeah.
No, I think so too, and that's where the way we spoke to each other.
Yeah.
Me and the dentist, she was really good at just super casual, and the way she answered my questions, she would say "Oh, if you were my younger brother, I would tell you to do this." It was so casual, but in a comforting way.
Yeah.
Because I feel when I go to these very Korean doctors or clinics or even hospitals. I was at a general hospital here. It's so tight. I feel so uncomfortable. I'm scared. Maybe also because my Korean is bad. And the doctor across from you, he was a teaching doctor as well, right? So he's high ranking in a Korean system sense, right? So, and I'm so bad at Korean that I feel so uncomfortable in a way because I'm oh, I need to remember my honorifics. I'm in this very, very pressured environment, I feel. But then, here I can speak a lot more casual and no one would take offense to it. And I think that was a very comforting thing.
I think so. I remember, your feedback right after your treatment in Zero. I'm not you said they are nice to you. You said
they were,
yeah. But those the team who are familiar with international patients, they can become more nice, right?
I don't know.
Because let's say there are the medical team who are not familiar with international patients. They don't want to approach you.
I think there's an apprehension to approach at least, but I think here, even though some of the clinic staff, they don't speak perfect English. We can't expect that of everyone in a clinic.
Right.
But they try.
Yeah, that's much better.
Yeah, exactly.
From my perspective.
Exactly. So they try, and that's when I feel a lot more met, even though it's not perfect, but they try, and they're they know also that you as an international patient, you're uncomfortable, right? Not because of the environment, just you're in a foreign environment and getting a health check.
So my advice for those local hospital and clinics, there are checkup partners. We are sending less customers because they are so focused on local patients. My advice was before language, hospitality is much more important. That's what I'm saying. And then, so the first impression is really. First impression matters.
Yeah.
So
we noticed the waiting rooms.
Yeah.
We noticed the receptions as well. And I think they were good. Pumin was, as I said, the fact that they call you and ask is just a sign of the hospitality
Pumin's
level.
chief director, Mr. Jung, he spent 2 and 3 hours with our, U.S. team, those Rebecca, Gabe, and William. he he he's young, not like in 30s or in 20s, but he looks passionate. I mean, I can feel his energy and you know, think about Hanshin's Ryan. Dr. Park, especially at Medi One, I mean, it's just 1 month she spent in New York. That's it. She has not studied in the States or in any English speaking countries, but still, she welcomes international patients. She approaches first the patients and speaks in English, and then I think it's very promising. I mean, our industry because the young medical generation grew up and opened their clinics. Yeah.
Yeah, so it's usually that's how I approach Koreans. I think it's nice even if you speak, broken English, not fluent.
Yeah.
No, I don't speak fluent Korean, but if we both speak broken English, broken Korean, I think we can meet at a similar level. You know, not us, but I mean that's how I approach a lot of my Korean friends. I think
that's our like official language within Himedi.
Yeah.
Broken English, broken Korean. William and I too.
Yeah, so I mean, it's how I meet my friends too. I say, listen, probably your English is better than my Korean, so we can try.
Yeah. Well, you know what? So I studied basically in New England area in the United States, where like American English is the standard. But one of our venture capital backed Himedi is White Star Capital.
Yeah.
They have like 6 offices in so many different continents. So while communicating with them, I thought, okay, American English I learned in New England is not standard. So that was like after after my business school in the States, and when I was like in the in 30s, yeah. So then I get more confident about my English. So okay, I just speed it. And anyway, this is side story. Okay. Okay. So okay, let's. This is the last part. Let's get back to your story. And then, what is your plan? I really want to start with open question, not business, not personal. So whatever, what's your plan
for life or for?
What's your two most important plans in next 2 years?
Oh, in next 2 years. Oh,
I said 2.
2 plans, 2 years. Oh wow, this was not in my prep.
Then
what? No, it's what was it? What is it? Plan in life. I don't know. I think we're. Let me ask in a way that can hopefully, we can play this back in my salary negotiation, where I'll say, getting about 2,000 patients for Himedi through at a high quality. Let's replay that when we have a salary negotiation next time. let's mark that as one plan. On a personal level, I think I need to study up my Korean a lot within the next 2 years. I think that's part of it. To just prove that I can. I've been in Korea for 3 years. I never studied Korean. I had to learn on like the fly, kind of like these types of situations, which is why I just pull Korean experience from everywhere, and it's not good. I think that's also in my plans somewhere.
I mean, people. So, 나는 너가 절대 피하고 싶은 거. What is something you want to avoid, or what is something you never change? I mean, 그,
In my
when I want to know about you, somebody, and when I want to know your most important value, 가치. I mean, I ask sometimes this question: something you want to never change. I mean, you never want to change
no.
in your life, your habit, or like you can you can say. You make a phone call to your parents once every week, and then you don't want to change it, something like that. So that shows what matters to your life. What is something you never change in next like now 1 year,
1 year and
shorter.
2 years.
Let's get
Yeah,
shorter.
short term. I mean, we can relate it to family. I think it's something important to me. I try to visit Denmark once a year. It was something we spoke about as well.
Right.
It's something I care about. I have a huge family, I know, but
Whose family? New information.
oh my God, it's like at family gatherings, if we're a small party, it's usually like 35 people.
In Denmark.
Yeah, in Denmark. Like my family in Denmark, like if it's a like close family, it's about 30 people minimum. And then like my dad had his 60th birthday last weekend. I think we counted 250 people through the house that day. So family is important to me, so I want to visit Denmark like once a year. There's something we spoke about as well as an important value for me. I think it's just one part of it. I value kind of my free time. What I do in my free time is I also spend a lot of time on sports, and it's something I hope to keep building on and keep as a regular part of my life for the next year.
Great. I want to ask one more question.
Go on.
So it's important to achieve our like business goal, like
2000,
yeah, something like that.
1500, yeah,
But what do you? I mean, except me. I mean, excluding me, because I'm CEO and you are speaking in front of CEO. It might be a very big pressure. What did you learn from working with your team, and what do you want to learn more from working with your team? Our team is very unique. Probably one of the most unique team in South Korea, right?
In Korea, definitely.
Yeah, you have U.S. team. You have less interaction with Mongolian team in Mongolia, but still.
I mean, I see them. I hear about what they're doing.
Munjin, here in Munjin. And, broken English, broken Korean, everywhere.
What did I learn? Yeah, I've been at Himedi for 4 or 5 months now. What have I learned in 5 months?
Nothing.
No, I mean, I came with a little bit experience before, right, coming in, so it's not from scratch. I think what I've had to adjust to the most, let me answer this way, is a general feedback I get from my, personal mentor, and I had growing up, was to understand that not everyone thinks like you do. So let's take a very real example. We have team members that have not studied abroad or been outside of Korea for 10 years of their life, which is normal. And the same goes the other way for our American team members, that they are very used to the American way. And I have to function as a bridge in many areas. And sometimes, cultural differences exist and they lead to frictions. This as CEO too. They exist and we have to manage them. And I have to consider sometimes why this issue arises and why it's an issue for the involved parties. I'm trying not to mention names or specific episodes here, but
I want it.
But when we have two very culturally distinct, that are so far apart, like a 14-hour time difference, it means we have to solve a lot in messages, And in messages, even between us, sometimes the tone or the understanding can be a little bit wrong. And I have to really check myself in not everyone thinks about this issue like I do, because maybe they're not from an English-speaking background, or maybe they haven't spent enough time with Koreans to understand why this is a sensitive issue. That's what I've had to learn, and I'm still learning, honestly, in Himedi.
So, and what do you want to tell new, let's say there is new, I mean, in your age, there are some people who are interested in working in Himedi. What do you want to tell them? What, sorry,
No,
but
no,
I have my
no.
question. So, what kind of people do you want, new joiner, you want to work with?
I think, it's two things.
Because you can help, new join,
Yeah.
right? Because you've joined 5 months ago and you're fresh. Basically, you are you can provide the right information. Yeah.
What any new joiner at Himedi needs to understand is that this one part is this customer first approach that we have, but also we have a high focus now on like building out our North American business, right? In US, Canada, especially. And you need to be able to understand the patient needs coming from these countries. And the best way, like the first thing you did when I joined was send me to the clinics to meet customers. And I think I took like our new joiner too, to like 1 or 2 visits as well to talk to customers to just get a sense of what we don't see, because we live in Korea, we live in other countries, of like pain points, and really get an understanding of like, what we hear. US is expensive, it's not as high tech, all these things, but hearing them from patients is really important. I think if you can nail that early on in your journey at Himedi, what we do becomes a lot easier to kind of pass out. Like if you don't get that, it's like, why did we choose this clinic when this clinic is cheaper? That answer you should be able to answer naturally, because what we talked about today with why we choose different clinics, right? The service level, the hospitality, the technology level. And then I think if you can nail that part, the understanding of our core business becomes a lot better, and what we're trying to develop it into. As for the type of profile, this is a question for you, like, why you brought me in, because it was not a secret when I interviewed that I didn't
expect your question.
that I like I'm not like I don't speak fluent Korean. I'm like from a very like specific background I came from Korean university, studied abroad as
Because
well.
I saw you can learn fast.
Exactly.
Yeah. So sometimes your experience is not helpful for you. So basically to automate our service and to use AI to provide more values to customers, I thought you are perfect because you has not majored in software. It's weird, right?
Yeah, no, but we talked about it.
My major is
Engineering.
computer and industrial engineering, then university, and that's not helpful because that structure. Conventional backend, front end, and then C or something like that.
Yeah.
Was not helpful anymore. And what I learned from in the medical tourism industry, is the name itself, medical tourism, is not helpful. You should think about it from zero base. And so I thought walking through your resume and listening to you, you already have many experience, and that means you learned so many things in short period. So that's that was very important. And second thing is you don't speak in Korean. You speak broken Korean. I like that. But in Korea, it's very easy. From partner standpoint, hospital and clinic checkup center, if I talk with those people working at the Korean checkup center, it's very hard to break down their business in a structured way and then think about differently. Try to understand within one checkup center, think about Korean business, international business, and what's the dynamics between them and why this their service it cannot be changing so fast according to the increase in the international patients. So I don't want you to be just part of Korean working culture or just try to follow what we have done. Basically, so I want you to change.
So, and I think that's the way you I can get an answer. I can answer my own question. It's like what I need from new joiners and what I'm looking for is like a sense of responsibility to your area, and then can you adjust to things? Because it's not a lie. Like we change the way we do things, we adjust to the new needs. We looked at the report from last week from the Medical Tourism Bureau, right? Of like how many travelers come to Korea, and the numbers, spiked like crazy last year, and that means we have to adjust. We have to adjust to new needs. And if you're not able to get that and adjust what you're doing to it, I think it's really hard. So I don't look at experience when I look at new joiners for Himedi and into like my area. I look at attitude and ownership.
Right.
I think that's more important. And then you can be 40 or you can be 18. Like, do you know what I mean? Like, it's an attitude or a mental thing. Like, I don't need to look at the rest necessarily. I think that's how I approach it. And then we have to think about it as a little bit of a startup mindset, the way we do things. So we need to be quick, right? That's like we need to adjust quickly. That's also part of it.
You are the quickest person. That's what I love.
That's a regular feedback I'm getting. It's I'm nearly too fast. I think I got.
But that implies you are running. Yeah.
But definitely, I think for anyone looking at Himedi, looking to join, I think we're not. It doesn't feel like a traditional Korean company I come into because I spent half of my time with the US one, and two, it's we work so fast that there are not really time for like these long drawn process of decision making and discussions and all this. We need to make decisions on the day, and that's I think something I appreciate a lot from being here.
It's the best advertisement.
Oh, I can do like a Himedi career advertisement is always great. We can clip this out and just post that with our next job posting.
Oh, great.
And I could use one or two more in my team. But
Okay. Thank you for your time.
Thank you so much.
Hopefully, let's do one more time next time.
Oh, absolutely. Yeah. We need a whole hour more, I think.
Thank you.